Hi everyone, welcome back to my series of how to identify the correct spotter in your exams. In this series, we will go across the high-yield clinical case-based scenarios of many syndromes. As syndromes may have common features, but we will focus on that hallmark feature that will help you to identify the correct syndrome in your exam. So let's get started guys with the first case-based scenario. Old child presents to the dental OPD with complaints of missing teeth, difficulty in speech. On clinical examination, the child has bilateral cleft lip and palate and hypodontia. Family history reveals that the child's mother had a similar case, orofacial anomaly during childhood. On inspection of the lower lip, you will notice two small symmetric pits near the midline that occasionally discharge clear fluid. Which of the following is the most likely diagnosis? There are four options: Pierre-Robin syndrome, Treacher-Collins syndrome, Crouzon syndrome, and Woude syndrome. Select the right one. So, when you encounter such questions in your exams, first look at the keywords that are mentioned. So, what is mentioned? That the child has bilateral cleft lip and palate, child has hypodontia, symmetric two small pits near the midline in the lower lip that can occasionally discharge clear fluid, and child's mother had a similar orofacial anomaly during her childhood. So these are your key points in this question. So now you have to narrow down to the answer. So the correct answer is your Woude syndrome. Now let us understand why that is the correct answer. The common overlapping features are what? Cleft lip and palate. That can be seen in both Pierre-Robin and Treacher-Collins. So you might get confused that it can be Pierre-Robin or Treacher-Collins because of the word cleft lip and palate. But what is the key identifying feature that will narrow down your answer to Woude syndrome is your bilateral lower lip pits. The lip pits are the hallmark of this syndrome. And why your other options are incorrect? Pierre-Robin sequence will have micrognathia, glossoptosis, airway obstruction, but no lip pits. In your Treacher-Collins syndrome, there will be mandibulofacial dysostosis, ear anomalies, but no lip pits. And in your Crouzon syndrome, there will be craniosynostosis with mid-face hypoplasia, and Crouzon syndrome will not have your cleft lip and your lip pits. So when you encounter such questions in your exam, always look for the keyword. In this question, the keyword is only one, that is your bilateral or unilateral lower lip pits. Now see, we can appreciate over here, these are the lip pits that are seen in your Woude syndrome. Now let us move to the next case-based scenario. In this, a 10-year-old boy is brought to dental clinic by his parents with complaint of multiple missing teeth, your first key point, and difficulty in chewing. On examination, the child has sparse, thin, light-colored hair and dry skin, your second key points. Intraorally, conical-shaped teeth are seen with multiple teeth congenitally missing. The parents also report that the child rarely sweats even during hot weather and often overheat after playing outdoors. So what are the main key points that you will find? First, conical teeth, sweats, the child has sparse, thin, light-colored hair and multiple missing teeth. What are the options that are given? Hypopituitarism, cleidocranial dysplasia, ectodermal dysplasia, and amelogenesis imperfecta. Now you have to narrow down your answer, as correct option is only one answer. So the right answer is your ectodermal dysplasia. Now we'll understand how. See, the common overlapping features with other conditions are what? Multiple missing teeth, that is also seen in cleidocranial dysplasia and ectodermal dysplasia. Now what are the key identifying features? Like there is a triad of 3H that is only seen in your ectodermal dysplasia. That is, one is your hypohidrosis, that is with there will be reduced or absent sweating with heat intolerance, that is the hallmark. Another one is your hair abnormalities, that is hypotrichosis. The patient will have skin dryness, abnormal sweat glands seen in ectodermal dysplasia. Now why your other options are incorrect? Because In hypopituitarism, there may be growth retardation, but sweat gland or hair abnormality pattern is not seen over here. In your cleidocranial dysplasia, there will be multiple supernumerary teeth, as it has been mentioned that the patient had multiple teeth congenitally missing. And there will be delayed eruption and clavicular defects but no hypohidrosis. In your amelogenesis imperfecta, there are only enamel defects. So you might get confused with cleidocranial dysplasia, but the key point over here is your hypohidrosis. That is when it is mentioned that the child rarely sweats and even during hot weather, and the child often overheats after playing outdoors. Over here are the images of the patient with ectodermal dysplasia. We can see sparse hair over here, and over here the conical shape of the teeth. Now let's move to our next case-based scenario. In this, a 6-year-old child is brought for dental consultation due to irregularly placed teeth and difficulty in cleaning. On examination, the child has mid-face hypoplasia, high arched palate with crowding of teeth and hypertelorism. You also notice syndactyly involving the second, third and fourth fingers of both hands. One of the very important key points, second, third and fourth fingers of both hands. The parents mentioned that the child has had recurrent ear infections and mild developmental delay. Which of the following is the most likely diagnosis? Again, you have 4 options: Crouzon syndrome, Apert syndrome, Treacher-Collins syndrome and Pfeiffer syndrome. Now select the right option. So in this, the correct answer is Apert syndrome. Why? I'll explain you. See, the common overlapping features that are with other syndromes is 1. Craniosynostosis with mid-face hypoplasia. That is seen in your Apert, Crouzon and Pfeiffer syndrome. So all these 3 syndromes will have your mid-face hypoplasia, as it has been mentioned. So by elimination, your Treacher-Collins syndrome has been eliminated. Now hypertelorism is also common in all of these craniofacial syndromes. So what are the key identifying features? That is syndactyly, fusion of finger and toes, that is especially involving the middle 3 digits, is the hallmark of Apert syndrome. So in the question they have mentioned that the child has syndactyly involving the second, third and fourth fingers of both the hands. Now why other options are not correct? In your Crouzon syndrome, there is craniosynostosis without any limb anomalies. So over here it has mentioned that the child has limb anomalies. So your Crouzon syndrome is eliminated. Next is your Treacher-Collins syndrome. In this, the child will have mandibulofacial dysostosis and no syndactyly, no craniosynostosis. And your last is a Pfeiffer syndrome. There is craniosynostosis with broad, medially deviated thumbs and great toes. So when you can get confused in your exams between your Apert syndrome and your Pfeiffer syndrome, but you have to make a note, in your Apert syndrome there will be syndactyly involving the second, third and fourth fingers of both the hands. This is also called as they can mention sometimes in your exam that the patient had mitten hands. Mitten hands is one of the key words for this syndrome. So now let us see the images of this syndrome. See, there is a small mnemonic for this syndrome, that is Apert. A stands for acrylopcephaly, P is premature suture fusion, E stands for eye bulging, R is for retruded mid-face and T is toes and fingers are fused. So in the name of the syndrome itself, there is a mnemonic. Over here we can see these are the mitten hands. So this is all about your Apert syndrome.